It's another day with the physicians where your health is our business. My name is Dr. Martina Agbere, your usual anchor on this program. We'll be discussing congenital heart disease in children. And with me in the studio, we have a consultant pediatrician. He is also a consultant cardiologist, pediatric cardiologist. He is the MD, CEO of Except Children's Hospital. She is Dr. Chinyere Uzodinma. Doctor, you're welcome to our program.
Thank you so much, Dr. Martina.
You're looking
Pleased
good.
to be here. Thank you so much.
You look really nice. So let's go straight. We're going to be discussing congenital heart disease in children. So first and foremost, you want to tell us about the heart, okay? What we need to know about the heart before we, just a general overview of the heart, then before we deep dive into the congenital abnormalities. So we need to know the normal before we go into the congenital one, the abnormal.
Okay. Thank you so much.
You're welcome.
It's my pleasure, and it's often a thing of delight to talk about the heart, particularly in children. Now, we all know that the heart is like the center of life. So without the heart, nothing else can survive. Therefore, the heart is the first organ to actually be formed in the human person. Indeed, the beating of the heart is what signifies that life has begun. Therefore, little wonder that 20 days after a woman misses her period, the heart has begun to beat. Therefore, oftentimes, when people have not even discovered that they are pregnant, the heart is already there, beating quietly. And then the human person is just like a flat membrane, a flat surface, before all the differentiation and everything that happens to the embryo begins to happen. Now, coding down on the heart itself as an organ, the heart is a complex organ. In fact, it's one of the most complex organs in the body. It has 4 chambers within it. But beyond those 4 chambers, there are what we call great arteries, very big pipes, like the plumbing in your house, you know, those big ones. There are big pipes that have to take origin from the heart in order to ensure that all the vital organs are properly supplied with blood. And of course, like I said, the heart is the organ that is responsible for pumping blood to every other organ that exists in the body. So like I said, there are 4 chambers. These 4 chambers, we often like to talk about them like a 2-story building with 2 rooms upstairs and 2 rooms downstairs. And between each of the rooms is a complete partition, so that whatever is flowing on this side does not necessarily transfer to the other side through the wall. So there's a thick wall separating them, and the circulation is properly regulated so that there is an outflow tract from the heart and there is also inflow tract. So blood flow must go out from the heart through the outflow and then flow into the heart, back into the heart through the inflow. So as we go on, we will now get to understand when we say that there is congenital heart defect, what does it mean? Now, essentially, you know, Dr. Martina, you've introduced it already. You said a defect that is present at birth. That is essentially what makes it congenital. So it's present at birth, and the heart is the organ that is affected. Now, the presence at birth does not mean that the symptom is there at birth. So the symptom can develop at any time, because some women will say, but my baby was well at birth. How can you tell me at 5 months old that there's a problem? Yes, the problem was there at the time the baby was born, but it wasn't discovered until a later time. So that is what that term congenital means, you know. So I would like to, you know, describe congenital heart defects in 2 dimensions. There are 2 broad types of congenital heart defects. Some people like to look at it as the blue type and the pink type. But essentially, medically, we call it cyanotic and acyanotic. When we say cyanotic, it means it connotes something. Blue type blood oxygenation is impaired. When we say acyanotic, it connotes another thing. Blood oxygenation is okay. Now, why do we have to describe them in these two parts? Because it actually determines the cause, the symptom, the kind of presentation, and the kind of approach to care that the child requires. Okay? Now, going further on this, it's important for me to state that there are some congenital heart defects that are called critical congenital heart defects. In other words, these critical congenital heart defects, when children are born with them, you actually need to have a surgery for them to repair them immediately, because the implication of not repairing them is death within a few days after birth or barely a few weeks after birth. Therefore, you can find some children who are born with congenital heart defects and they need surgery urgently, immediately after delivery. But there are also others who are also born with congenital heart defects, and then the doctor says, no, we don't need to do surgery now. We can wait until later. Therefore, there are different types of congenital heart defects. There are up to 40 different types. Some of them are minor, some of them are major, like I described the critical ones. There are others which are not critical, as in not life-threatening immediately after delivery, but they are major defects that they must be repaired. And then, depending on the types, the essential role of the pediatric cardiologist is to do what? To maintain the life of the baby who is born with a congenital heart defect by using a combination of medical treatments, and then determine when, at what point, that surgery would be required. Dr. Martina, it will be very important for us to state on this program, what should mothers look out for? Because sometimes it's actually the mother's instincts that brings them to the hospital. And it's important for mothers who are watching to know what kind of symptom should I look out for in the baby.
Okay, so before the mothers look out for the symptoms, you want them to know the possible causes first.
Okay,
what
great.
are the possible causes? But doctor, you hold it there, so because we need to keep up with the physicians.
All
we
right.
need to hear what they have to say about
great.
Congenital heart diseases in children. And when we come back, we'll dive more into going to the causes, the possible causes, and the tips for mothers. We're back after this short break.
Okay, first of all, I know that this is the birth defect that affects children. I also know that this is the birth defect that it hampers the blood. I also know that this is the birth defect that hampers the flow of the blood from the heart. I know that this is the most common birth defects that affect children. And I know it affects a lot of children, but I don't know how much. Okay, I don't know much of these symptoms, but I know it causes tiredness when feeding, and it also causes sleepiness. The only treatment I know for these birth defects is surgery, but I think this is in severe cases.
Welcome back. If you have just joined us, you're on to your regular Health TV talk show, The Physicians, where your health is our business. We've been discussing congenital heart disease in children. And in the studio with me, we have a consultant pediatrician and also a pediatric cardiologist. She is the MD CEO of Excel Children's Hospital, Dr. Chinyere Uzodinma. She's been schooling us on congenital heart diseases, what actually is a congenital heart. She actually did describe how the heart looks like, and she said something about it looking like a house. The top floor and the ground floor, up and down. And she actually broke it down. I'm sure we actually understood what we understood what she said. Now we want to talk about the possible causes before giving us the tips for mothers to learn. So Dr. Chinyere, you want to go ahead and tell us what are the possible causes?
Sure. So, well, mothers don't like to hear that there is no known cause. But unfortunately, that's the commonest cause. Idiopathic. That's the commonest cause. Nothing essentially causes congenital heart defect. However, However, we try to talk about risk factors. In other words, the difference between this and causative factors is that you don't have a direct cause and effect relationship. Because there are some with these risk factors who would not have children with congenital heart diseases. But there are some with the risk factors that will eventually end up having those children. And what are they? We talk about genetic. So if a first child or a particular child in the family is born with a congenital heart defect, the risk of another child being born with a congenital heart defect actually increases to 25%. So the risk is higher if there's already a child with congenital heart defect. Secondly, there are certain syndromes that increases the risk of congenital heart defect. The commonest of them is the Down syndrome. I'm sure we've talked about this before. The Down syndrome is a chromosomal abnormality. Don't worry about the big term. The most important thing is that it is something that happens in the genes. Now, it is not transmitted from the father to the mother, but a mistake occurs in the gene at the level of the chromosomes that alters everything about the child. And then the child comes down with Down syndrome. And for the singular reason that the child has Down syndrome, the risk of congenital heart disease increases by 50%. Meaning that for every 100 children with congenital heart disease, we expect or look at it that half of them might have a congenital heart disease. Every 100 children with Down syndrome, at least half of them will come down with congenital heart disease. Now, secondly, moving on to other things, I like to talk about congenital rubella syndrome because it's actually one of the causes of congenital heart defects or risk factors that can be preventable. So when a mother in pregnancy, particularly in the first trimester, when I talk about first trimester, I mean the first 3 months of pregnancy. If a mother who is in her first 3 months of pregnancy develops rubella, rubella is what people commonly call the German measles. And it's like people generally know the symptoms. A rash on the body with little or no illness, you know. Sometimes a low-grade fever or just feeling of unwell. And most times it doesn't take people to the hospital because it just fizzles out by itself. But however, the virus that is responsible for rubella is teratogenic. Teratogenic means it has the potential to cause a defect in a developing embryo. And most of its effect is now on the heart. It increases the risk of the child being born with a congenital heart defect. And it is very preventable. I think I want to talk about it now before even we move further. So, how do you prevent or reduce the risk of congenital heart disease as associated with congenital rubella? It's just by immunizing every girl child against rubella. Now, luckily, the immunity against rubella is a lifelong immunity. So by giving your girl child measles, mumps, and rubella vaccine, because it comes in, in that 3 combination as MMR. By immunizing your girl child with that MMR vaccine, you've actually done something ahead of time to prevent or reduce the risk of that girl child having rubella in pregnancy, which might lead to congenital heart disease in future, the girl child being pregnant. So that's by the side. The other thing I want to talk about is that there are some medical conditions that a mother may have that can predispose or increase the risk. One of them is diabetes in pregnancy. If a woman is pregnant and perhaps you had diabetes even predating the pregnancy, the doctors should be aware so that there should be proper control of the diabetes during the pregnancy. Secondly, some diabetes are associated with pregnancy. So the woman is not diabetic before pregnancy, but during pregnancy, diabetes develops. Yes, so it's called gestational diabetes. So such gestational diabetes also need to be treated properly during pregnancy. And that is why it is important to stress the need for early antenatal care. Immediately a woman misses her period and the woman is expecting pregnancy, the woman should actually confirm pregnancy and register for antenatal as quickly as possible. Now, the other thing I want to talk about that often interests me in terms of risk factors is risk factors related to drugs, particularly drugs that people buy over the counter. So usually, you know, Dr. Martina, when a woman is pregnant, the first signs are very non-specific. The woman may feel unwell, feel like she has malaria, may vomit, and all those early morning sicknesses. So oftentimes what some women do is that they just rush to the chemist shop and begin to buy anti-malaria, anti-this. But some of them, if you read the leaflets, you will find out that they are not safe in pregnancy. Now, without knowing that the woman is already pregnant, if you take those drugs quite early at that stage when the heart is forming, it has the potential to increase the risk. So what that means for those who are listening is that I usually describe it like this. If you're at risk of getting pregnant, you know, you're expecting to get pregnant, then you should be careful about over-the-counter medications. The medications may seem very safe, kata and all those things. I don't even want to go to the side of buying agbo and the other ones. Those herbal medications, those ones are even, yes, they are even a no-no for any woman who is expecting to be pregnant. Okay. So in a nutshell, these are some of the etiological factors.
Okay. You know, I asked you that you talk about the etiological factors.
Yeah.
Maybe we want to tell our parents out there, the mothers, everyone who's actually watching, the things that they should look out for. What are they supposed to know?
Okay, great. So the next thing is for mothers to know, what do you look out for? What are the early warning signs of possible congenital heart defects? The first thing I'd like to describe is when the baby gets home with the mother, there are things we expect to happen immediately after birth. Nature has made it that as soon as the baby is born, the baby begins to suck, to feed, and to gain weight. Therefore, we expect that as you go home, your child is feeding without difficulties. So once you start noticing feeding difficulties, there may be an early sign that there's a problem. And what do I mean by feeding difficulties? When the baby is not able to stay on the breast sufficiently to empty your breast, then there's a problem. Sometimes the baby may try to do that, but the baby gets breathless. It means that the baby is having some difficulty with that exertion of sucking. And then, exercise. Yes, so you just find the baby panting, and then it goes back. We call it suck rest cycle. When you notice that, it may be an early warning sign. Another early warning sign associated with breastfeeding is also excessive sweating. You know, like somebody who has been doing some weightlifting, you know, this baby breaks out into sweat, you know. So when you see that, there are signs that the baby is having problems with feeding, and it shouldn't be taken for granted. Secondly, because of these problems with feeding, the consequence of it is poor weight gain. So the baby is not gaining weight. So the birth weight, let's say the birth weight is 3 kilos. So oftentimes we expect that immediately after birth, the baby loses some part of that birth weight. But by 2 weeks, should be back to birth weight. And by the time the baby is getting to 1 month, he should have added maybe about 1 kilo or close to 1 kilo to his weight. If you're not seeing weight gain in the baby, there is a problem, and then you should be able to go back to the hospital and say, my baby is not gaining weight. There are also other things like the baby's color, changing color, especially around the lips. The lips get darker hue. If your baby is very fair, you may notice something like a bluish or violet coloring around the lips. Now, this is for the newborn period. Remember when I started in the beginning, I said that the symptoms may start at any time. Yeah. So I've just described some of the symptoms you can see in the newborn period. Okay. There are symptoms that will not present in some condition of these conditions that will not present in the newborn period, but they will present later. So some of them that will present later, maybe when the baby begins to crawl or the baby begins to walk, some of the things you can look out for. Some babies, you find out that when they are crawling, sometimes they find it difficult to tolerate that physical activity.
They are doing. So they are tired.
Yes, they are tired. So when you notice that, it's a problem. Again, essentially, some of them that have some of the conditions, you notice that sometimes, if there are babies who are already walking, they squat for some time. You notice that the child squats. And then sometimes when he squats, you notice that the breathing has gotten faster.
Yes,
that is also an indication that there may be a problem. And then subsequently, there are also some of them that would also present with recurrent chest infections. You go to hospital at this age, they say the child has pneumonia. The next time again, he has pneumonia. The next time again, he has pneumonia. Then you really need to find out, is there something else that may be causing the pneumonia? Again, Dr. Martina, I hope I can get to this one. You know, some people think that it's only in very young babies that you see congenital heart. But I can tell you, recently I've had a 15-year-old, you know, who is presenting with symptoms. Nobody actually picked it up. But a 15-year-old can complain, my heart is beating fast. My heart is doing boom, 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 boom. Then there is a problem. You don't just say, go and rest, go and sleep, go and drink water. Take the child to the hospital. Something may be wrong with that child. Yes.
Well, we have actually broken it down. I'm sure everybody actually followed all that you said. Before we just leave, how can this be managed? What is the outlook management? Outlook, so we can
so just in rounding up, you know, the outlook, I would say, depends on the type. Some of them have very good prognosis. And when I say very good prognosis, very good outcome. Some of them have, you know, I don't want to call it bad outcome, but I'll say, you know, yes, can be managed. Now, for those that have a good outcome, essentially, when the pediatric cardiologist evaluates this baby, there are certain tests that need to be done, and I need to mention them. Basic of them, and most important of them, 2 important tests: the ECG, or electrocardiography, and echocardiography. Out there, we commonly call it echo. These 2 tests are fundamental, mandatory to be done in order to diagnose. So after diagnosis, the pediatric cardiologist now determines, does this child require some medicines? Does this child require surgery? There are medical treatment, surgical treatment, and also device treatment for some of them, that you can close a hole without necessarily having to cut the heart open or cut the chest open.
Doctor Uzodinma, time is not always enough each time you come, because you are just on point each time you speak like this. I'm sure we'll be able to bring you back again to tell us more about anything that has to do with the heart as a cardiologist. So if you ask out there, I'm sure you actually have followed all that our consultant has told us today about congenital heart disease. You have 2 different types, and there's management. Presentation is very, very important. When you present early, the child can actually be managed. So I'm sure you had a good time today, keeping up with us on your regular program, The Physicians. Well, don't forget to follow us on our social platforms, on Instagram, Facebook, YouTube. And if you want to be part of this program, don't forget to go to our website and just complete the form. We invite you to be part of our program. My name is Dr. Martina Agbere. Till next time, stay blessed.